want to introduce to you about the needles. As I've told you, it is only around 1 hour talk among regards to syllabus which we have for the main batches which we take. So I'm going to keep it a bit brief. It's a curtain raiser. As we told you, it is a curtain raiser. In a curtain raiser, it won't be a very, very complete and composite class, but I'll try to for you. So what is the aim of taking this class? One is to introduce to you introduce OPU to you, how it all started and how it is progressing of OPU needles. OPU needles. Their technical and commercial aspects of it. Which one to buy, which one not to buy, which has got better outcome. These are all things which we would be talking, and how to handle, how to identify them. So OPU, in case you look at the OPU procedure, it's an ultrasound guided procedure in today's world, and here we need an ultrasound, we need an OPU needle, and we need an OPU pump. OPU pump. These three things are required here before we start doing our ovum pickups. So now we are always intrigued to know how it all started. It was in year 1973 when we had the first published paper by D. Kreitzer on transfer of human zygote. This paper, in case someone of you have it, I don't know, but I couldn't get the whole paper online. It's not available here. And it's got few full text links. They are on payment, and how ironical, and which we get is now available offline, but this article is not available. You only get an abstract of this article. And beautiful article which came up in somewhere in 1973 on 29th of September, which speaks about the first human zygote. So the methods of doing OPU, how it all started, it was laparotomy. Done by laparotomy. This is the way it happened in 1973, most probably. Process of laparoscopy, and laparoscopy is the way by which Louis Brown was born, and it was a Edward and Peter. This we all know. This thing happened in 1973, 78. Then we had back-to-back 8 cases coming from Monash pregnancies. Then in USA, we had a couple of pregnancies where they used gonadotropins. Meaning that before this, they were working on a natural cycle. And USA, they started with gonadotropins. And then as we moved towards 1980s, we had Fretzer and Lane from Switzerland, who came up with the method of ultrasound USG OPU, and then came the concept of OPU needles. That's the way the whole process evolved. But this is not the part of the talk today. I just want to give you some glimpse at it. It's not happened that these needles have come all of a sudden. They've evolved over 1980. So from 1980 to 2020 is nearly 40 years. 40 years they have evolved. And today what we're going to talk to you about is available to us, which we use every day. and it didn't happen overnight. It took a long time. Learning doesn't occur overnight. It takes years to build up our practice and build up our technical skills. So now today, when I start my talk, I'll talk to you about some basics of OPU, about OPU needles, the parts of the needles, and of course, I'll talk to you about the OPU pump in short. These disposables you require to start with the OPU, and the technical parts of it, I'll become procedural parts, and the OPU procedure I won't discuss. Words on OPU needles. So I always like to go into the depth of the things. As gynecologists or as in doctors, we are aware that we are having these type of cannulas. We have a cannula of 18 gauge, 21 gauge, 22, 25, and as we move from 18 to 25, become this we are fully aware of, and every cannula has parts. Look at the parts of the cannula when we cut it from here. Suppose it cut, we will get something like this. We will get this inner diameter. This will be the outer diameter, and this will be the wall thickness of the needle. Wall thickness of the needle. Just remember that in case we make this wall very thin, it won't penetrate the ovary. Won't, and it will become soft and malleable. Soft and malleable. So to have a particular thickness of the needle, we just can't make it thin. A thin needle will become very flexible and there are problems. So I'll just look at this needle now. I have a needle in front of me. So see this. In case we take this needle and we make it very thin, then the needle. So to give it some weight and give it some strength, we have to keep a specific gauge. There's a gauge of the needle, which you can see. There's a gauge. You can see an opening, that will be the gauge. And that will have a certain amount of wall thickness. It can't be a very, very thin needle. Because very thin, it won't go inside the ovary of the. This is about the needle gauge. They're all made up of stainless steel. There's 4 or 306 to make this particular needle. So needle has to have some amount of weight, strength, and it has to have an ideal gauge, a black openings. Am I audible to you all? Can you all see the black?
Yes.
Yes, keep
Yes,
talking.
sir. Yes, sir.
So this is the.
We can see it, yeah.
So this getting needle very close to you. That's the way I teach. I've told you when it won't be there in the books. So see this needle. This is the needle entry point. Pretty sharp, and it is. I'll talk about the tip as I go ahead in the class. These are the few parts of needle, and you have to realize that we have to have a needle of an ideal gauge. The reason being, this needle is not to take out blood. It is not to be put in my to get blood. It's gonna go inside the ovary. in the ovary, it is not there to or some fluid. The aim of this needle will be to suck out eggs. Now, simple logic I will tell you, which you have to know, that in like this, in case we take a very small gauge needle, say I take a 20, which is very thin, and I start aspirating an OCC complex. There, we start aspirating. This will, this won't go inside. It'll get somewhere here. So what do? I want to suck it in. It's not going in. I apply more pressure. When I apply more pressure, it'll be pulled in. But as it is going in, it will rupture or have trauma. Because the OCC complex is a huge complex. So what do? We say, okay, we'll take a bigger and we take a needle gauge which is bigger. So now we take, say, 16 gauge. 16 gauge we take. So this OCC complex again, it goes inside and it will be something like this. It will be small. So what will happen when it keep hitting the wall like this, like a pendulum? When it will hit the wall of the needle, what will happen to the OCC complex? There would be a non-laminar flow, and there would be some amount of turbulence, and the egg will again take the negative suction. So one important thing we have learned from this needle gauge is that needle gauge has to be appropriate for a particular procedure. For needle, which is of size of the OCC complex, where it fits in very beautifully, just slides in. So this ideal needle, in case you look at when you want the proper sliding, be around 17 or 18 gauge. So we can't use thinner than that. We can't use bigger than that. This you have to know. So I'd like to ask all of you one very simple question. We're working in the labor room and we have a patient who comes to us with PPH. Adult comes to us with a PPH. Bore cannula will we use? Anyone can make a guess. Take a shot.
16 gauge.
Very right. Why such a big gauge?
Rapid infusion of fluids.
Very good. Very good. Very good. Very good. So now in case a newborn child, he is also in shock. A newborn child who needs blood transfusion or care, IV cannula, gastroenteritis. What gauge will you use for a neonate?
24 or 20.
Very right. Child is in shock. We can use 18 there also. But will 18 work for that child?
No.
That's problem. So we have to pick up the appropriate size for appropriate case. For OPU, we pick up 17 gauge needle ideally. Okay. The first take-home message I want to give to you. Otherwise, you will get a lot of input from the people around you that buy that, it is very thin, very soft, but it doesn't work out that easily. So pick up the needle which is of the appropriate size for the OCC complex aspiration. Done. With this background, why is this thing important? Gauge is important. For this lovely chart, which I take for my people when we have our long classes. focus on the outer, focus on the, focus on the outer diameter. This is the outer diameter. This is the inner diameter. This is a wall thick. When we use a 34 gauge needle, which is very thin, or use 20, the inner diameter is around 0.051 millimeter. When we come 7 around 1.067, I'll equate it with 1 millimeter. So what have we learned here? We have learned that for doing ovum pickup, we need an appropriate diameter of to 18 gauge needle. A 17 gauge needle will give you an internal diameter of nearly 1 millimeter. Is it all clear to you?
Yes.
Yes, I wanted to say yes. Dr. Madina, how are you doing?
Thank you. Thank you.
Good.
Yeah.
So we have to understand the concept of the needle gauge. All these things are directly correlated with the follicular respiration. We have got dynamics. We've got dynamics of oocyte aspiration or profiling, we call it. I won't be covering for much. I'll just focus on OPU needles and how to optimally utilize them. But all these gauges will have different pressure dynamics or the follicular fluid aspiration. So one thing which is important for us is the needle gauge, which we have spoken. Second is we have to focus on the needle length. And third is we have to know about the plastic tubing. So these few things we have to always focus on before we buy a needle. Can someone tell me the temperature of an OPU and IVF lab? What is the temperature? No one doing IVF amongst you?
24.
24, 24. 26 degree centigrade. Now, this means that in case we have an ovary and we have got the oocyte, and you have to pluck some oocyte from here and you put the needle inside. Just from this needle, there will be a plastic tubing going to the collection system. We've got something called collection system, which I'll show to you a bit. Here, this zone is 37, but as you move out of the vaginal vault, this is a vault, and you may find temperature here. In case you have a long tube, the temperature line cased in a test tube heater is 37 degrees centigrade. But this journey go to around 34 degrees centigrade. And lesser temperature, we will have more chance of spindle damage or deposit. If the damage is less than 1 degree centigrade, then recovery is possible. But in case we have duration of the damage of less than 1 degree centigrade, the damage may become irreversible. Very important point. So we have to keep our needle always of appropriate length. We can't very tubing. We have to keep tubing of appropriate length. Now I'll show you something. This is the tubing. This tubing is made up of some sort of plastic, and normally it is polyethylene. See the tubing doesn't end, it's going, and finally bunch we call it, and then we have another part coming out, and this normally goes in the tube. It goes in the aspiration. This goes in the OPU pump. I'll do an 14 ml round bottom polystyrene tube, which I'll show to you. This tube length, in case you have a very long tube length, which becomes convenient for surgeon to operate, because when we are operating, we are putting when the needle goes inside, we want enough space and suction pump or the tube collection. So we need more tube length. But avoid buying the big because it will make the eggs cooler. Try to keep it as short as possible. Remember this. The second part I want to do. Then this is the concept of the needle length. How long should we have? Can we make it 30 centimeter? Or we can make it 50 centimeter. It's a big science on it, and it all depends upon the fluid dynamics, suction dynamics, and depend that we have defined the needle gauge. Which the needle gauge, this has been defined. The length of the needle has been defined by a lot of fluid. The length of tube has been defined by a lot of studies, and the length of from the collection system to the suction machine, the lured lock here, has also been defined. So let's see what do the definitions say and which is an ideal tube for you when you start your. The aim of the talk is to empower you with some data, with some facts. When you want to buy an OPU needle, no one should be able to tell you that buy that particular thing because he likes it. You make your own opinion, and that's the reason we are having this particular class. I am just switching off from, I'll go to full screen and try to show you points here. So we have a needle like this. Then always come in some sort of packing. Whenever you buy the needle, always buy the needle double packing. Don't buy the needle which comes in a single packing. Means that there should be a pack between the pack. Needles. So this needle, as you can see, is from a company called Cook. They have got a particular diameter, a certain criteria showing as they proceed further. So they come in packs like this, and they have got in the end, they have got something like this, where the date of the expirer, the date of manufacturer, and all these details are written in the end. Here is a needle, which is a 17 gauge needle. You can read 35. It is a 35 centimeter needle. Tube length. So it's 17, 35, and 90. This is from one which is on the market. I've shown you that brand. Then it has something written over here. They talk about data manufacturer, date of expiry, single time use. I'll show you these things from more near. But you have to know that this is in ideal needle dimension which we are using. So this 17 gauge in thickness with a 1 millimeter internal diameter, length of the needle, and it's got 900 millimeter of tubing. This is one of the brands I just wanted to show to you, and I'll show to you other brands also. By no means I work for any company. Again and again, I don't work for any company. I'm going to show you the things which I have with me, which I'm using. So, which I'm going to show to you now. This needle is called Vitrolife. The Vitrolife needle, you can see the dimensions of this needle are 17. This needle is 17 gauge and it's a single lumen needle, and this has got the similar parts as other needles. Here it is. The 17 gauge of 1 millimeter, and then it's got a metal hub. All which I've shown you before had a plastic hub. This has got a metal hub from stainless steel, gives you good grip. And in case you follow it from here to here, having this metal hub is, once we keep our finger here on the top, we hold a small depression here and a small depression here. And this water, put it like this and pull it on, we find that we are entering the bevel. It will be the direction of this hole on the top. Now, what is every needle has got a direction, and the direction should be. Now, this is another needle from a company called Wallace. Have got certain things written over it. You must learn to read these signs. We got an I written here. I means read the instructions before you use. They have written put like this, means it is for single time use. So they write certain instructions which we have to before we start doing the pickups. And this is about the quality check, which I will show to you from Zohed. So this needle, in case you look, has got the 17 gauge, and in case you can see it on the top, this needle is 33 centimeter. As you can see here, it is 17 gauge and 33 centimeter. What you saw before, which I showed to you, they were 33 centimeter needle. So all these needles, they come in different gauges, they different ends. So we have to pick up the needle of your choice. This is from a company called, this comes from the CCD, which is made in Paris. In case you look, this needle will have the length of the tubing here, as you can see here, this needle is has got a tube is of 100 centimeter and the needle length is 30 centimeter. 30 centimeter. So what we have learned now is that all the needles have dimensions, different gauges, and we have to pick up the needle which actually suits our flow. With this, I will go back to my PowerPoint presentation and use important things about the OPU needles. So we were here before I entered. Now, in case you look at the different techniques of ovum pickup, we had laparoscopic and we had transvaginal ultrasound. So all had their own complications and good things. But out of all, we have picked up the method of transvaginal ultrasound, and this is the most ideal method for doing the pickup. I won't go into the details of these things, but you should know that the ideal method of doing ovum pickup is by using OPU needle, and we should be using TVS guided OPU procedure. Now a close-up of the needle which I showed to you is from Cook Medical. Just take one picture. As you can see, it is a 17 gauge needle. 35 centimeter is the needle length from here to here, and the tube length is around 900 millimeter. And these are few of the criteria which they write have to follow. So this we use is a single needle, single OPU procedures. So here we always have date of manufacture, date of expire, single time use, never open end, never use an open pack, protect from sunshine, protect from multiple things they write, and we have to follow the guidelines of a particular company. Just a very important part of any OPU needle is the bunch, which you can see here. It has to fit on a, and this becomes the collection system. So all the fluid coming will get collected in this tube, ml collection tube. Needle parts here. Now I'll show you the picture from the close-up of all the needles, and let's see what makes a needle different from other needles. So we've got this is a grip. We call this whole thing is the needle. So we look at the length. Gauge is normally 17 gauge and length is around 35 centimeter. After it ends here, then we got a silicone grip here, and from here we'll have this is the length of the tubing, and this will go into the tube. This will fit into the tube, and this can be around 90 centimeter. And we have one more connection coming from the silicone bunch. This part will have a lure lock, suction pump. All these needles are non-coring. They're non-coring. They are eco-marked, and they've got triple cut. So let's see what these terms mean. we have these have got to look at these needles. This the way they look like this. All these needles will have some markings near like this. They are called echo markings. Can be etching. You can have etching. So when the ultrasound hits in needle, send ultrasound waves in this needle, it will touch and go back, the same line. So visibility will be there, but not very good. When we make it echogenic and make the surface very serrated, when ultrasound waves come, they go in all directions. They go in multiple directions and make this thing very much visible. Call it an echo tip. So all these have a tip. This is important. And they have a color coding. 16 gauge we have blue handle. For 17 gauge red. Then silicone bunch is a very important part of the thing. And then we should have a good Lear lock in the end, which can connect with the ovum suction pump. All the needles should be having triple grind, we call it. So in case you look at these needles, in case I can show to you, all these needles have got cut. So in case you can see this, it is ground here on the top. Sides also the needle has been properly cut thoroughly, and the bottom part, and the needle is also very much polished cut. So it's called a triple grind method, where every edge of the needle from top, side, and the lower, it is called a triple cut needle. That makes the needle extremely sharp. Sharper the needle, more are the chances of having a smooth injury.